If you're wondering how Americans feel about their private healthcare system, well, you found the right video because I'm going to go over some of the reactions to the targeted hit on the United Healthcare CEO, Brian Thompson, which has been so overwhelming that they even had to take down a Facebook post about it. So let me first start with the news in case you missed it. United Healthcare CEO fatally shot outside New York City hotel in premeditated, pre-planned targeted attack. So his wife, Brian Thompson's wife, Paulette Thompson, said he had been receiving threats. Quote, there had been some threats. Basically, I don't know, a lack of coverage. Speaking on a lack of healthcare coverage. I don't know the details. I just know that he said there were some people that had been threatening him. So let's be clear in case this shouldn't have to need to be said. But let me say it anyways. Killing people is wrong. Don't shoot people. All right? I hope we're all on the same page there. The reason I'm showing you these reactions here is to help explain why something like this can happen in a system where people feel so powerless. This is simply cause and effect. So, this gets to, just as an aside here, people like Bernie Sanders, that CEOs, especially healthcare CEOs, billionaires, they hate Bernie Sanders because they're trying to limit their power in society. He wants to bring more power back to the people, less power to those at the top. And they hate him for it. But they should be embracing him because this is the alternative. Events like this are more likely to happen in a system where people feel so powerless. So let me get to actually, first, this news came out later on. The words, quote, deny, defend, and oppose appeared on shell casings recovered from the scene. So they're examining whether the words relate to a possible motive involving insurance companies and the responses to claims. Again, we still don't know for sure why this happened, but even apart from that, for me, what's more interesting is the reaction to it. And it really just showcases how broken the American healthcare system is. And this is somebody speaking as a Canadian who never thinks about healthcare until I need it. I don't argue with insurance companies. We don't have health insurance companies. We do for some extended coverage, but it's not something that you need. It's just nothing I think about. Like if I need the doctor, I go to the doctor. If I need healthcare, I get the healthcare. I don't pay out of pocket. It just happens. It's through my taxes. I don't think about it. It's just how it works. It's much different for Americans, especially looking at some of these reactions and some of the like claims being denied, people being denied coverage while they're laying on the table to get surgery. I'll get to I think that example later on. Like there are so many examples that people are sharing of how this system has destroyed them, and those are the people that have survived. So let me get to, there have been many headlines like this now. Axios writing, United Healthcare CEO's killing unleashes social media rage against insurers. Let's start with this. Doug Henwood shared this image from Facebook. The United Healthcare Group shared their reaction to Brian Thompson. And if you scroll down, 19,000 people put a laughing face on the news. That's compared to 1.9 with the crying face, 1.6 with hugging a heart. They eventually deleted this Facebook post. I think it got to like 21,000 likes or 21,000 laughing faces before they deleted it. Giving you an idea of how little sympathy people have for the health insurance industry. United Health in particular is incredibly, you could argue is the worst among them. One example of that, they use an AI model with 90% error rate to deny care. That was according to a lawsuit. The lawsuit argues that United Health should have been well aware of the blatant inaccuracy of NH Predict. That's their AI model. NH Predict estimates based on its error rate, though few patients appeal coverage denials generally. And the reason for that is just who the hell wants to be on a phone or who has the time even to be on a phone for hours arguing with an insurance company in an argument that you're probably going to lose anyways. So most people just eat the cost. And that's, part of the reason why The most common form of bankruptcy in the US is medical bankruptcy, which is practically unheard of in countries with universal healthcare systems. But they're going to right here. When United Health members appeal denials based on NH predicts estimates through internal appeals processes or through the federal administrative law judge proceedings, over 90% of the denials are reversed, the lawsuit claims. This makes it obvious that the algorithm is wrongly denying coverage. So they use this broken AI model that they know most people are not going to try and appeal anyways because they don't want to deal with the system, making money off the backs of sick people who are then going bankrupt, many of them, because of these sorts of costs. It is just that this isn't just an issue with this company. This is a rot at the heart of a private system where the motive of a private insurance company isn't to help you, it's to make money, it's to increase shareholder value. That is why, just generally, one of the big benefits of a single payer system or some kind of public system is that there's no profit motive. Your tax money or whatever you're paying through your taxes is going to be less compared to what you pay to private insurance because you are taking the profit motive out of it. That's why places like whether it's Canada, countries in Europe, they pay less through their taxes than they do to a private insurance. Let me rephrase that. They pay less overall in healthcare costs because there is no profit motive and they get more coverage. So more coverage, paying less. There's no in-network, out-of-network. Everyone's under the same network. It's a single system. There are just so many benefits, and I've discussed these benefits again and again about a single payer system or a public system, not having to worry about losing your job or being able to make the decision to leave your job and maybe be self-employed and not worry about losing healthcare coverage because you still have healthcare guaranteed to you because it's a public system. So there's countless benefits. Not having to argue with insurance companies. I've never in my life had to talk to an insurance company. There is just so many benefits that it can be hard to summarize them all now. But nearly 60% of those surveyed by Kaiser Family Foundation last year said they'd experienced problems with their health insurance, such as denied claims or difficulties with provider networks. Among insured adults who saw a doctor more than 10 times in the previous year, nearly one-third experienced problems with requirements that the health insurer sign off on an item or service before it's covered. Just endless issues with health insurance companies. There are 1,000 examples like this of individual examples. So United Healthcare tried to deny coverage to a chronically ill patient. He fought back, exposing the insurer's inner workings. So this is a rare case where a patient actually fought back. This is from about a year ago. It's from ProPublica. They go on to write here, United flagged McNaughton's case as a high dollar account, meaning it was costing them money. And the company was reviewing, or I should say, costing them more than the average person. I'm sure it wasn't costing them money. They still make massive profits. But the company was reviewing whether it needed to keep paying for the expensive cocktail of drugs crafted by a Mayo Clinic specialist that had brought McNaughton's disease under control after he'd been through years of misery. At one point, court records show United inaccurately reported to Penn State and the family that McNaughton's doctor had agreed to lower the doses of his medication. Another time, a doctor paid by United concluded that denying payments for McNaughton's treatment could put his health at risk, but the company buried his report and did not consider its findings. The insurer did, however, consider a report submitted by a company doctor who rubber stamped the recommendation of a United nurse to reject paying for the treatment. So, burying facts about the patient as a way to benefit their bottom line. And this is one person. One person that was able to expose this. Think of how often this happens. It is an absolutely insane system, but it is the natural conclusion of a system where the motive is profit, not healthcare coverage. Also doesn't hurt that their lobbying since 1998 has been over $100 million in lobbying the U.S. government. And you wonder why neither party is interested in changing the system. Yet, there were a few people, of course, all within the Democratic Party or aligned with the Democratic Party in terms of Bernie Sanders, AOC, Rashida Tlaib, a handful of others. But the vast majority of Congress is not interested. And this is a big piece of that. And contributions, by the way, also worth mentioning, but half of these are from employees. So it's, just because you work for a company and give to a campaign doesn't mean that you're doing it because of your job or because you want to protect the company you work for. So that's why I don't put as much stock in this number. But still, 100 million in lobbying is insane. Okay, Clipperstein also shared this graph here. So let me show you the full piece. Worst insurance companies for paying claims. So United Healthcare is the worst insurance company. Claim denial rates by insurance company. They are the worst here at 32%. That is wild. So in case you see your insurance company here, know where you stand. Kaiser Permanente seems to be by far the best. Kylie Chung shared this. The way we're socialized to see violence exclusively is interpersonal and not see state violence. Policies that create poverty/kill, structural violence, institutional violence is very deliberate. Same with panics about crime, shoplifting versus how much corporations steal from every single one of us. It is it is wild how we have been conditioned to not view violence through policy the same as interpersonal violence. It it seems almost innate or human in a way because if we see one person attacking another person, that is visually striking in a way that you know an insurance claim being denied is not. Yet the outcome is the same. So especially on a mass scale, there are people out there. I'm saying people out there. There's some people arguing or making the point that there is likely more blood on the hands of that CEO than there is of most world leaders. And it's hard to deny that. To think of just the level of healthcare that has been denied to people that has a direct impact clearly on their lives, many of them either going bankrupt over it or simply not being able to afford the coverage or not going to get healthcare coverage because they're afraid they may be denied or that they can't afford it, and then dying because of the system that they live under. Now, again, I do want to bring it back to this. This is an issue with the system, not necessarily, one company, one CEO, one person. It's an issue with the system. But it's important that we are able to view this in a way where we consider the impact of policy and health insurance companies in the way that, we view an interpersonal sort of event like that. Now, this reaction from Scarlet Red is similar to a lot of the reaction that I was seeing online, which often helps us reframe an issue or reframe this issue in a way that we may have not thought of it before. But as she writes here, kill one person and you're a murderer, kill 100,000 and you're increasing shareholder value. It is wild how we as a society accept certain things as just being normal and okay because they are part of the system, because it is the way things are, because it is the way policy is, because it is the way a corporation operates. Because it's been accepted as normal, it's perfectly fine when it's not. We need to be able to see these issues in a way that is not just the way it is, but our policies and the way a system operates that can and should be changed if the political will is there. That involves pressure on politicians, that involves activists, that involves a mind shift in really not accepting that it's okay that private insurance is embedded, that a profit motive is embedded in healthcare when it shouldn't be. Amy Ash sharing, if you don't work in or have to frequent an ER, you might think the violence of health insurance denials is metaphorical. It is not. Ken Klippenstein sharing this news. I mean, there seems to be countless headlines about United Healthcare generally, and just the wild things that they are involved in. But Slain United Healthcare CEO was sued by a firefighter's pension fund in March for insider trading and fraud. The suit alleges he sold $15 million in company stock while failing to disclose the DOJ investigation into the company. Last post here. And I was going to show more examples of people and their various experiences with whether it's United Health or private healthcare generally, but there is so much of that online that it's hard to kind of pick and choose. But I think this is the ultimate point to take away here. Though I don't presume it's indicative of all, it's compelling to see how widely disdain for the UHC exec is shared, a bipartisan feeling. While on the road stumping for Medicare for All, I talked to quite a few conservatives moved by Bernie's vision of healthcare beyond for profit insurance. This gets to if the Democratic Party actually cared, not just forget cared about people, because that's out the window in terms of any party caring about people, cared about winning, they would understand this is the kind of energy they need to harness. There is so much hatred, universal hatred, regardless of who you vote for, universal hatred for the private healthcare system. This is a single payer healthcare system is the easiest thing for a party to embrace that would net them the most amount of support because it would be a direct and clear benefit to their lives. And Bernie had a whole breakdown of how he would do it. It would, year by year, it would they'd be expanding Medicare to lower the age, every year a bit more till everyone is covered. Like there are various ideas and processes in on paper of how you would implement this under the current system. It would simply be expanding of Medicare that already exists. The idea that this is, an alien concept to politicians is only because of the amount of money and lobbying that they have been uh, that the health insurance industry have used to pressure politicians.